Hi, good morning to everyone. Welcome to my YouTube channel, My Nursing Guide. Myself, Indla Srinivasarao, Nursing Officer, JIPMER, Pondicherry. Today I came up with some important questionnaires from medical surgical nursing. So this is mainly useful for the candidates or students who is preparing for the nursing competitive exams RRB, BHU, AIMS, JIPMER, PGMR, NIMANS, RML. You know that nowadays there are many vacancies are there. In every year there is a nurse set coming with many vacancies. So let us start today's session. Before starting our session, please subscribe my channel if anyone is not subscribed. Let us start first question. The primary cause of anemia in the client with a chronic renal failure. Option A, poor iron absorption. B, destruction of the red blood cells. C, lack of intrinsic factors. D, insufficient erythropoietin. The right answer is D. Insufficient erythropoietin production is the primary cause of anemia in the client with a chronic renal failure. Answer A, B and C do not relate the anemia seen in the client with a chronic renal failure, therefore they are incorrect. The second question, the nurse identifies ventricular tachycardia on the heart monitor. The nurse should do immediately if the patient is develop any tachycardia on monitor. So what nurse should do immediately? Option A, administer the atropine sulfate. Option B, check the potassium level. Option C, prepare the administer an antiarrhythmic such as lidocaine. Option D is defibrillate at 360 joules. Answer is C is correct. The treatment for ventricular tachycardia is a lidocaine. A precordial pump is sometimes successful in slowing the rate, but this should be done only if the defibrillator is available. In answer A, atropine sulfate will be speed the rate further. In option B, checking the potassium level is indicated but not in a priority. Option D, defibrillation is used to pulseless ventricular tachycardia or ventricular fibrillation. Also, defibrillation should begin at 200 joules and be increased to the 360 joules. So the answer is C is the correct answer. Question number 3. The doctor is preparing the removed chest tubes from the client's left chest in preparation for the removal, and the nurse should instruct the client. If the patient is having ICD tube and they are going to remove, so what should nurse instruct the client? Option A, breathe normally. Option B, hold his breath and beard down. Option C, take the deep breath. Option D, sneeze on command. The answer is B is correct. The client should ask to perform the Valsalva maneuver while the chest tube is being removed. This prevents changes in the pressure until an occlusive dressing can be applied. Answer A and C are not recommended, and the sneezing is difficult to perform on the command. So here the client should hold their breath and bear down. It's just like a Valsalva manual because to maintain the pressure in the chest. So question number 4, the nurse is taking the vital signs of the client admitted with a cancer of the pancreas. The nurse is aware that the fifth vital signs is anorexia, pain, insomnia and fatigue. The right answer is B. All of you know that the fifth vital signs usually we consider as a pain. Okay, so the fifth vital signs is pain. Nurse should assess and record the pain just as they would temperature, respiration, pulse and blood pressure. Answer A and C and D are included in the charting but not considered as to be a fifth vital signs. Fifth question, a 24 years old female client scheduled for surgery in the morning Which of the following is the primary responsibility of the nurse? So if the patient is posted for the any surgery, so what should be done by the nurse in the early morning? Taking the vital signs, obtaining the permission, explaining the procedure, and checking the lab work. So here the right answer is A. The primary responsibility of the nurse is to take the vital signs before any surgery. The action in answer B, C, and D are the responsibility of the doctor, and therefore incorrect for the this question. So usually our nurse's responsibility before any surgery. So first thing is that we monitor the vital signs, because before surgery there is a changes some vitals, because the patient may be anxious. Sometimes the patient is not psychologically agree for surgery, so there is some elevations in the vital signs. That is the first priority whenever we are sending the patient to the operation theater, right? Sixth question. The patient states, my stomach hurts about 2 hours after I eat. Based upon this information, the nurse suspects the patient likely as a. If the patient complains that after taking food 2 hours after taking food, he is having some stomach discomfort. So option A, gastric ulcer. Option B, duodenal ulcer. Option C, peptic ulcer. Option D, curling ulcers. So here the answer is B is correct. Individual with the ulcer within the duodenum typically complain of the pain occurring 2 to 3 hours after meals as well as at night. The pain is usually relieved by eating. The pain associated with the gastric ulcer, answer A, occurs 30 minutes after eating. Answer C is too vague and does not distinguish the type of the ulcer. Answer D is associated with the stress ulcer. So here the answer is a B. Seventh question. Which finding is the best indication that client with ineffective airway clearance needs suctioning? So what is the best indication for the airway clearance? So option A, oxygen saturation. Option B, respiratory rate. Option C, breathe sounds after. Option D, arterial blood gases. Answer is C. Changes in the breath sounds are the best indication of the need of suctioning in the client with the ineffective airway clearance. Answer A and B, C, D are the incorrect, because they can be altered by the any condition. See here, oxygen saturation can be varied by the any condition, like if the patient having any chest injuries or any COPD and all. So there is a variation in the oxygen saturation and respiratory rate also, and sometimes ABG analysis also will be varies by the different conditions. But when there is a severe secretions are there, so the first altered in that indication is breath sounds. Which of the following is the common complaints of the client with the end stage renal failure? Weight loss, itching, ringing in the ears, and bruising. Answer B is the right. Pruritus or itching is caused by the presence of the uric acid crystals on the skin, which is common in the client with the end stage renal failure. Answer A, C, and D are not associated with the end stage renal failure. So usually whenever there is a damage to the kidney, so there is a increase in the blood urea. So this uric acid is causing some irritation to the skin. So that leads to the itching. Ninth question. Which of the following finding is associated with the right side heart failure? Shortness of breath, nocturnal polyuria, daytime oliguria, and option D, crackles in the lungs. So here the right answer is B is correct. Increased widening at night is a symptom of the right side heart failure. Answer A and D are incorrect, because they are symptoms of the left side heart failure. And answer C does not relate to the client's diagnosis, therefore it is incorrect. Which of the following skin lesions is associated with the Lyme's disease? Lyme's disease is one of the tick's disease. So here option A, bull's eyes rash, papular crust. Option C is the bullae. Option D is the plaques. So the right answer is A. Lyme's disease produces the characteristic annular or circular rash, sometimes described as a bull's eyes. They look like a bull's eyes, so it is called as the bull's eyes rash. Answer B and C and D are incorrect because they are not symptoms associated with the Lyme's disease. So next question, 11th question. Which information should be given to the client taking a phenytoin, that is a antiepileptic drugs? Taking the medication with meals will increase in its effectiveness. Option B, medication can cause sleep disturbance. Option C, more frequent dental appointments will be needed for the special gum care. And option D is the medication decrease the effects of the oral contraceptives. So answer C is the correct here, because after taking the phenytoin long time, so there is some gums problem like gingival hyperplasia is a side effect of the phenytoin. The client will need more frequent dental visits. So answer A, B and D do not apply the medication, therefore they are incorrect. Next question. A client has returned to his room following an esophagoscopy. Therefore, before offering the fluids, the nurse should give the priority to assess the client's option A, level of consciousness. Option B, gag reflexes. Option C, urinary output. Option D, movements of the extremities. The right answer is B, is the correct. Client gag reflexes is depressed before having the EGD, esophageal gastroduodenal scopy. The nurse should give priority to checking the for return of the gag reflexes before offering the client's oral fluids. Answer A is incorrect because conscious sedation is used. Answer C and D are affected by the procedure, therefore they are incorrect. 13th question. The nurse should observe for the side effects associated with the use of the bronchodilators. A common side effects of bronchodilator is the tinnitus, nausea, ataxia and hypotension. Answer B is the correct answer. The side effect of bronchodilator is nausea. Answer A and C are not associated with the bronchodilators, therefore they are incorrect. Answer D is incorrect because hypotension is a sign of the toxicity, not a side effect. 14th question. The client with a bowel resection and anastomosis returned to his room with a NG tube attached to the intermittent suction. Which of the following observation indicates that nasogastric suction is working properly? So option A, client's abdomen is soft. Option B, client is able to swallow. Option C, the client has active bowel sounds. Option D, the client abdominal dressing is dry and intact. Option A is the correct. Nasogastric suction depresses the stomach and leaves the stomach soft, non-distended. Answer B is incorrect because it does not relate to the effectiveness of the NG suction. Answer C is incorrect because it relates to the peristalsis, not effectiveness of the NG suction. Answer D is incorrect because it is relates to the wound healing, not the effectiveness of the NG suction. The nurse is teaching the client with insulin dependent diabetes the sign of hypoglycemia. Which of the following sign is associated with the hypoglycemia? Option A, tremulousness, slow pulse, nausea and flushed skin. So the answer is A. Tremulousness is the early sign of the hypoglycemia. Answer B and C and D are incorrect because they are symptoms of the hypoglycemia. Here tremulous means here there is no any tremors. The client with insulin dependent diabetes takes 20 units of the NPH insulin at 7 a.m. The nurse should observe the client for signs of the hypoglycemia at. If the patient is giving 20 units of NPH, so when you have to assess their effects. So at 8 a.m., at 10 a.m., at 3 p.m., at 5 a.m. next day. So answer is C is correct. The client is taking NPH insulin should take the snacks mid-afternoon to prevent the hypoglycemia. Answer A and B are incorrect because the times are too early for symptoms of the hypoglycemia. Answer D is incorrect because the time is too late. The client would be in a severe hypoglycemia. 17th question. Which diet is associated with an increased risk of the colorectal cancer? Low protein, complex carbohydrates, high protein, simple carbohydrates, high fat, refined carbohydrates, low carbohydrates, complex proteins. So answer C is correct. That diet that is high in fat and refined carbohydrates increase the risk of colorectal cancer. High fat contents results in an increase in the fecal bile acids, which facilitates the carcinogenic changes. Refined carbohydrates increase the transient time of the food through the gastrointestinal tract and increase the exposure time to the intestinal mucosa into cancer causing substances. Answer A, B and D do not relate the questions, therefore they are incorrect. The nurse is providing dietary instruction for the client with iron deficiency anemia. Which food is poor source of the iron content? Option A, tomatoes. Option B, legumes. And option C, dry foods. And option D is the nuts. The correct answer is A. Tomatoes are poor source of the iron, although they are an excellent source of the vitamin C, which increases iron absorption. Answer B and C and D are a good source of the iron, therefore they are incorrect. Which early morning activity helped to reduce the symptoms associated with the rheumatoid arthritis? Option A, brushing the teeth, drinking a glass of juice, drinking a cup of coffee, and brushing the hair. The answer C is the correct. Holding cup of the coffee or a hot chocolate helps to relieve the pain and the stiffness of the hands. Answer A and B and D do not relieve the symptoms of the rheumatoid arthritis, therefore they are incorrect. The client with a congestive heart failure has been receiving digoxin. Which finding indicates that medication is having a desired effect? So option A, increase the urinary output, stabilize the weight, improve the appetite, increase the pedal edema. So answer A is the correct. Digoxin slow and strengthens the contractions of the heart. An increase in the urinary output shows that the medication is having a desired effect by eliminating the excessive fluid from the body. Answer B is incorrect because the weight would decrease. Answer C might occur, but it's not directly related to the questions. Therefore, it is incorrect. Answer D is incorrect because pedal edema would be decreased, not increase. A 21st question. The client is admitted with a suspected abdominal aorta aneurysm. A common complaint of the client with a abdominal aorta aneurysm is option A, loss of sensation in the lower extremities. Option B, back pain at lessen while standing. Option C, decreased urinary output. Option D, pulsation in the periumbilical area. So option D is the correct answer. The client with a abdominal aortic aneurysm frequently complains pulsation or feeling my heartbeat is in a abdomen. Answer A and C are incorrect because they occurs the rupture of the aneurysms. Answer B is incorrect because back pain is affected by any changes in the position. 22 question. The client is admitted with the acute adrenal crisis. During the intake assessment, the nurse should expect the finding that client as option A, low blood pressure, slow regular pulse, warm and flushed skin, increase the urination. Answer A is the correct answer. The client with acute adrenal crisis as symptom of the hypovolemia and shock. Therefore, the blood pressure would be low. Answer B is incorrect because the pulse would be rapid and irregular. Answer C is incorrect because the skin would be cool and pale. Answer D is incorrect because their urinary output would be decreased. The nurse is admitting client with a suspected duodenal ulcer. The client will mostly report that his abdomen discomfort lessens when option A, skips meal, option B, rest in a recombinant position, option C, eats a meal, option D, sit upright after eating. So this question already we discussed in the previous. So answer is C is the correct answer. Pain associated with a duodenal ulcer is lessened if the client eats a meal or snacks. Answer A is incorrect because it makes the pain worsen, and option B is refers to dumping syndrome, therefore it is incorrect. Answer D refers to the gastroesophageal reflexes, therefore it is incorrect. 24th question. The client with breast cancer is returned to the room following a right total mastectomy. The nurse should option A, elevate the client's right arm or on pillow. Option B, place the client's right arm in a dependent sling. Option C is the client's right arm on a bedside her. Option D, place the client's right arm across her body. The right answer is A. A is the right answer. The total mastectomy involves the removal of the entire breast and the some or all of the axillary lymph nodes. Following surgery, the client right arm should elevated on pillow to facilitate the lymph drainage. Answer B, C and D are incorrect because they would not help to facilitate the lymph drainage and would create the increased edema in the affected extremities. The client with diverticulitis is admitted with nausea, vomiting and dehydration. Which finding suggests complication of the diverticulitis? Option A, pain in the left lower quadrant. Option B is a broad-like abdomen. Option C is a low-grade fever. Option D is abdominal distension. So, your right answer is B. A rigid or broad-like abdomen is a suggestive of the peritonitis, which is a complication of the diverticulitis. Answer A, C and D are common findings in the diverticulitis, therefore they are incorrect. 26th question. The nurse is preparing to give an oral potassium supplement. The nurse should, if the patient is suggested to give a oral potassium, so what should do the nurse? Give the medication without diluting it. Give the medication with 4 ounces of juice. Give the medication with water only. Give the medication on an empty stomach. So answer B is the right answer. Oral potassium supplement should be given at least 4 ounces of the juice or rather the liquids to prevent the gastric upset to discuss the unpleasant taste. You know that whenever we are giving the potassium, so it will give some odor, bad odor, and it will be very uncomfortable taste. So we have to give this medicine along with some juices which will be makes the patient to comfort. Twenty-seventh question. A client who was admitted with a chest pain, shortness of breath as a standing order for the oxygen via mask. Standing orders for oxygen means that the nurse can apply the oxygen at 2 liters per minute, 6 liters per minute, 10 liters per minute, 12 liters per minute. Option B is the correct answer. With standing orders, the nurse can administer oxygen at 6 liters per minute via mask. Answer A is incorrect because the amount is too low and not helpful for the client and shortness of breath. And answer C and D have the high oxygen level and requires the doctor's order. 28th question. The physician has ordered aspirin therapy for the client with a severe rheumatoid arthritis. The sign of acute aspirin toxicity is option A, anorexia, option B, diarrhea, option C, tinnitus, option D is pruritus. The right answer is C. Tinnitus is the sign of the aspirin toxicity. Answer A, B and D are not related to the aspirin toxicity, therefore they are incorrect. 29th question. The client with hiatal hernia has been taking the magnesium hydroxide for relief of the heartburn. Overdose of the magnesium based antacids can cause the client to have. What are the complications of the magnesium hydroxide? So the option A, constipation, option B, weight gain, option C, anorexia, option D is diarrhea. The right answer is D is the correct answer. Overuse of the magnesium contain the antacids result in the diarrhea. Antacids contain the calcium and aluminum cause the constipation, therefore answer A is incorrect. Answer B and C are not associated with the use of the magnesium antacids, therefore they are incorrect. So today's last question is 30th question. Which statement best describes the difference between the pain of the angina and the pain of the myocardial infarction? You know that this sometimes is very difficult to differentiate angina pain and myocardial pain. So the first option is pain associated with the angina is relieved by rest. Option B, pain associated with the myocardial infarction is always more severe. The option C is the pain associated with the angina is confined to the chest area only. And option D, a pain is associated with the myocardial infarction is referred to the left arm. So the right answer is A. The pain associated with angina is relieved by rest. Answer B is incorrect because it is not a true statement. Answer C is incorrect because the pain associated with the angina can be referred as a jaw, left arm and back. Answer D is incorrect because pain from myocardial infarction can be referred as a other than the left arm. So here we complete today's session. These are some of the important most frequent asked questions. So for the further updates, please follow me, like my video, subscribe my channel.